In this video, we're going to discuss and demonstrate a neck strengthening program over a period of about 4 weeks. Now, we know based off of research that neck strengthening exercises and endurance exercises in most cases are superior to manual therapy and other passive techniques. Now, that doesn't mean that massage or joint mobilizations or manipulations or modalities don't feel good to the patient, they don't have a response, and that can mitigate some of the neck pain you're having, especially acutely, or maybe it allows you to tolerate some of the strengthening exercises, range of motion exercises. But for the purpose of this video, we're going to go over neck strengthening exercises specifically. The first thing we're going to do is going to be neck isometrics. And what isometrics are is where there's a muscle contraction, but there's no movement of the joint. Basically, if I were doing a concentric contraction with my head and I'm going to do lateral flexion, then I would bend my ear towards my shoulder. That's concentric, meaning that the muscle origins and insertions where they start and stop are getting closer together. Okay, so with an isometric, that origin and insertion is not going to get closer together. They're going to stay at the same distance, but the muscle is going to contract and go into tension. So I'm going to show you the same movement as an isometric. I'm pushing into my hand, okay, and I'm holding that. I'm contracting those muscles on the side of my neck there, and then I'm going to relax. So that would be an isometric. So initially, if you're having a lot of pain, isometrics work really well at, allowing you to kind of turn on and turn off the muscle, kind of re-educate the brain to that proper firing sequence without the perception of increased pain or threat because you're not going through these movements, whether it's flexion, extension, whatever those movements are. So the thing that I have my patients do, or the first thing that we're going to do, is going to be isometric exercises, and we're going to go into forward flexion first. I'm going to take my hands like this, put them on my forehead. I'm trying to bend my forehead down, bringing chin to chest. So I'm going to push down, and I'm going to hold that initially maybe 25%, not really hard, because we don't want to over-aggravate or overstimulate the nervous system into, again, perceiving threat. We don't want to encourage spasms, So I'm going to go in, I'm going to hold that about 3 to 5 seconds and relax. And then I'm going to go again. I'm trying to go down 3 to 5 seconds and relax. If you're having radiating something down one of your arms and you can't put your, the other arm up there, just use one hand. That's fine. Just use the one hand and pushing forwards and then relax. And so I repeat that for maybe 10 to 12 repetitions at a light exertion of muscle contraction, maybe 25%. It's going to be really easy, and I'm going to do that for the first week. Go through these isometrics, and I'm going to show you the other movements now. So that was forward flexion, going forwards. And I'm going to do side bending to the left. I'm pushing in and contracting. I'm going to do side bending to the right. Okay, same thing, holding for 3 to 5 seconds, completing 10 to 12 repetitions. And all of this initially, first few days, I maybe only do one set, right? And I may repeat this cycle of exercises a couple of times a day. Because there's no added resistance, we are able to tolerate this multiple times a day versus later in the program where I'm going to show you how to use resisted bands. So those are going to be a little bit more where you're going to need a little recovery from that. Okay, so that's forward flexion. We've got side bending left, side bending right, and now we're going to go rotation. So I'm going to put my hand here on the left portion here, my temporal and the frontal area, kind of both there. And I'm going to try to turn my head and look to the left. I'm rotating, left rotation, same way. And then I'm going to go right rotation, same way. And I'm going to hold that and go through those repetitions. Now, after each movement, you can stop and rest. Some patients will just go through the whole thing and not rest at all. That's fine either way. Just depends on your pain and kind of what you can tolerate, what you can do. So you're going to go through those. And now we're going to do protraction and retraction. So protraction is where I'm trying to bring my head forwards like this, just straight forwards. So I'm going to hold my head here on my hand. I'm pushing straight forwards, push, 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 pushing against there, right? Do the same thing. And then I'm going to do retraction where I'm trying to kind of do that chin tuck movement. I'm going to put my hand behind my head and I'm going to push into my hand. Again, you can use one hand, you can use both hands, just whatever you prefer to do. It doesn't really matter. But go through one set of all of those, and again, that's something you can do several times a day. So that is isometrics. You're going to do that for 2 or 3 days. Then you're going to increase the amount of force that you're exerting. So you're going to go from maybe 25%, jump up to 50, 75%. Ideally, by about 10 to 14 days, you need to be putting close to maximal effort. So you're really pushing pretty hard. If it's too much for you to use your hand to press against, I have a lot of people take a towel and they'll roll up a towel, put it against the wall and push into it that way. Put it on the floor, on the bed, or if you have someone at home that can help you to kind of push against you, that works well too, right? So if it's just too much for you to be able to exert, go through the exercises effectively and kind of maintain that motor control in the posture and position that you're using, then you can do those things and get that assistance of someone. Now we're going to use this resistance band. I like these bands. You can get a set of these, pretty inexpensive. I'm going to put a link in the description. And they're different colors and they also represent the different levels of resistance. A lot of these will have, will say on it, is it light resistance, medium resistance, heavy resistance, etc. So I'm going to put the band just behind my head here. And so then I'm going into extension, just looking up towards the ceiling, right? And then we're going to do lateral flexion, those same movements that I just went over with those isometrics. And so you're going to go all the way around and do those the same way. Now, with this though, there is going to be, this is called a concentric movement. So that origin and insertion is going to get closer together. So when I'm going into forward flexion, the origin and insertion of my neck flexors are getting closer together. Extension the same way, rotation, side bending, etc. That's called a concentric movement. So you're going to do that and you're going to repeat that for 2 sets to 3 sets, 10 to 12 repetitions. Now this one, I probably would not do this point of these exercises more than twice a day. Now this was going to start at about the 10 to 14 day mark using the bands. People will ask, do I continue with those isometric exercises? That's fine. A lot of people will still use those to warm up before they start using the bands and do the other exercises. That's great. In order to build true strength, we need to progressively load or overload the tissue. So there's only so much, to some extent, that you can do with isometrics, although they are powerful for several things. That initial acute phase of irritation and pain. To get everything moving, to help to desensitize the nervous system, and then to also start to re-educate those muscles of proper kind of clicking on and clicking off of the muscle contraction. So again, I'm going to do these starting at about day 10, give or take, and then maybe day 14, and we're going to progress with the resistance level that we're using. Every 2 to 3 days, I'm going to increase the resistance that I'm using, or that I'm using this during this exercise. If the resistance is so much that you can't go through a good range of motion, in other words, if I can't bend my ear pretty close over to my shoulder because the resistance is so much, I'm going to back off of that resistance so that I can make a good muscle contraction and go through that range of motion. Because remember, with all of this, we want our brain to learn good movement patterns, right? We don't want to reinforce a poor movement pattern that we've had because of pain or stiffness or weakness with another poor movement pattern because we're trying to do too much resistance or too many repetitions too soon. So this is going to be done 10 to 14 days. We're going to repeat this for the remainder of the 4 weeks of the program. Now we're going to do scapular retraction. So I'm squeezing my shoulder blades together. I'm going to pinch them together in the back. At the same time, I'm performing a chin tuck, or that cervical retraction, just like that. So I'm going to hold the band out in front. And again, you don't have to use this particular band. It can be all different kinds of bands. They have the kinds with the handles that attach, just whatever you want to use. So I'm going to hold this here out in front. I'm going to pull this apart. When I pull it apart, I have 2 ways I can do this. I can really pull it apart so that I feel it in the back of my shoulder. That's not so much where I want to feel this. Although we can't isolate this necessarily with this movement. You're going to feel it in the back of the shoulder, but I want you to feel that with your shoulder blades squeezing together. So squeeze the shoulder blades together. Okay, and at the same time, retract your chin and neck back. So I'm going to squeeze together, retract back. Squeeze together, retract back. I'm going to complete 2 to 3 sets, 10 to 12 repetitions of that exercise. That exercise will start on day 10 or 14 and is going to go with the rest of your band exercises that you're doing for your neck for the remainder of the 4 weeks. And just like those band exercises for the neck, you're going to do that a couple times a day. I really wouldn't do it more than 2 or 3 times a day because you may over-irritate the area. Now we're going to go into neck extension endurance exercises. So we can do this several ways. And my favorite way to do this, honestly, is I just prop up on my elbows here, my forearms. I have my forehead facing down towards the mat. I retract to bring my chin back, just like in that chin tuck position, kind of squeeze my shoulder blades together in the back. I hold that position somewhere between 5 to 10 seconds is what I'm shooting for about 10 to 12 repetitions, and then I relax. I can let my head drop down. I'm going to come back and hold that again. A lot of people will kind of alter that and go into more holding the head back in this position in like an upper cervical extension. You can do that, that's fine. But for me, I feel like with my patients, they do better if we keep the forehead facing down. You're looking down at the surface below you and just retract back, squeeze those shoulder blades together and hold it. I think that way of doing it does really well, and you're going to feel more benefit, kind of a burn with that. You're going to start that exercise on about week 2, so about 14 days, and you're going to do that for the remainder of the program, and that can be done several times a day. Our goal with that is to get to where we can do a single repetition and hold that. I usually tell my patients for about 40 seconds. I have some that can do it for a minute eventually, but I think that if you can hold it for about 40 seconds, we're doing pretty good. The last thing we're going to do is going to be a deep neck flexor endurance exercise. And so we know that based off of research that when the deep neck flexors are weak or they have poor muscle endurance, the trap muscle can take over, and that can cause things like tension headaches and discomfort in the neck. So what I'm going to do is I'm going to look straight up. I'm going to have, my foot. So what I'm going to do is I'm going to look straight up. I'm going to tuck my chin in, right, to make that chin tuck. And I'm going to pull the back of my head off the mat just a little bit, just so that I could put one hand underneath between the back of my head and the mat. If you get 2 hands or 3 hands high, you're too high. So tuck the chin in, bring my head off, hold it. I'm working on 5 to 10 seconds, and then relax. There's 1 repetition, chin tuck, head up, hold it, 5 to 10 seconds, and bring it back down. And you're going to repeat that for 2 to 3 sets of 10 to 12 repetitions. As always, I appreciate you guys watching, and thanks so much.